it is now time to show you how helium-free operations can truly impact your clinical practice and how it influences better care for more people. And for that, I would like to invite on stage two of our customers, Dr. Julia Camps-Herrero, who is Chief Breast Care of Ribera Group Hospitals in Spain, and Professor Sebastian Keller, Head of the Cardiac Imaging Unit of the Heart Center in Charité in Germany. Well, give them a warm welcome. Thank you very much on stage. Have a seat. And after all the great insights already shared today, it's actually very great to have you here on stage with us as our customers. To start with you, maybe Professor Keller, could you share with us how BlueSeal has really changed or advanced your clinical practice in cardiac MR from an operational perspective?
For us, it is really important as a tertiary center that we can really rely on our system. When we are scanning patients from several weeks old until 100, let's say, that we can trust that it's working, and this is something what the system offers. So we have almost no downtime anymore, and also the maintenance time is not there, and we can just perform the scheduling of our patients without interruptions.
Yeah. It's actually great to hear that all these capabilities we just discussed about BlueSeal indeed truly impact your operations on a day-to-day basis. Dr. Camps, what about you? How do you experience the operational benefits?
Well, for us, it's just about peace of mind. Mm-hmm. There is no risk of also downtime, no risk of interruption of our everyday procedures, mm-hmm. because it is really very hard to overtake whenever we have interruptions. So it's like, yes, peace of mind.
Yeah, it's very good. It's really reassuring for you.
Yes.
Yeah. Maybe also to stay with you, Dr. Camps, can you share with us how BlueSeal has really, what it has changed from you in terms of clinical practice? What does it allow you to do today that you could not do before?
Well, really our performance, our clinical performance has improved because for such a complex indication as breast cancer imaging, breast cancer staging, breast cancer follow-up, high-risk patients, we need very solid tools and we need to have good clinical performance. And as a result of all the good quality, all the good features that we have in terms of acceleration, image quality, scan time, mm-hmm. and also motion-free techniques, which are really very important in breast imaging, where you are looking at very, very small lesions. This is very, very important, and it really has enabled us, as you can see in the image, to bring down a very complex and challenging sequence such as DTI, diffusion tensor imaging, from 11 minutes to less than 4 minutes, almost less than 4 minutes, which is amazing.
Yeah, yeah, indeed. The reduction from 11 to 4, that's really impressive. And I think a really great example of BlueSeal in combination with acceleration can really help. Right. Professor Keller, we all know that cardiac MR is still a very complex domain within MR. How did it really help you to advance cardiac MR at your practice?
So for us, it's really important that we get an image quality which is sufficient enough to make out a diagnosis, mm-hmm. especially in patients who are suffering from arrhythmias, who are wearing devices, ICDs, pacemakers, and anything else. And the system really brings us up. So we get a good image quality to make out a report, which has a significant impact on patient's journey, changes the treatment, maybe is also offering new diagnosis. And this really helps. Another point is the speed, because now we're running our cardiac protocols just in a maximum of 30 minutes, even for very advanced protocols, including stress or cardiomyopathies, quantitative imaging of T1, T2, T2 star maps, and all this is included in the time frame. Otherwise, we wouldn't be able to have a volume of more than 3,500 cases a year, cardiovascular.
Mm. So it really helps you to reduce rescans, shorten scan time for your practice.
Definitely.
let's shift gears a little bit and focus to patient outcomes, because at the end, that's where it all matters about improving patient outcomes. Dr. Kamps, can you elaborate a bit how your system really supports you to get to better patient outcomes for breast care?
Well, it's all about precision imaging, because as shown by the mammography screening conundrum, the earlier you diagnose a cancer, the higher the survival, the better the prognosis. And it all comes down to finding these very small, we've coned it down to 2 millimeters. Now we can detect cancers which are 2 millimeters. And it's also very important that we stage the patient carefully. In this case, for instance, that you're seeing on the screen, these patients had a very small invasive cancer, which you can see, but thanks to MR, we diagnosed a very large intraductal cancer, which changed the surgery of the patient completely. But even more, the patient did not go on to mastectomy, which would be in the old days or in the not so old days. The patient was treated with breast conserving surgery thanks to MR-guided surgery. So as you can see, it impacts the life and the treatment of our patients directly. And another thing which is also coming is the improved precision in imaging in order to de-escalate unnecessary treatments. Now we are using MR to guide cryoablation, that means percutaneous freezing or treatment of cancers, and we are also doing it in conjunction with another 2 Dutch centers. We are doing vacuum-assisted excision of breast cancers, thanks to the fact that the negative predictive value of MR is almost 100%.
Yeah. I find it really truly inspiring that you just shared with us. I think it's really great to see that we talk about the system, but it's not only from an operational perspective, but it really touches upon improving treatment management and touching really the life of patients. So thank you very much for sharing that. Professor Keller, can you also share a bit more on how it really impacts patient outcomes from a cardiac perspective at your site?
The cardiology guidelines recommend in almost all pathologies maybe a cardiac MRI as a class 1 or 2 indication, and mostly they tell us you should perform late gadolinium enhancement imaging using gadolinium. And with the new system, we have been able to reduce the amount of gadolinium we gave to the patient to a maximum of 0.1 millimole per kilogram per body weight. And this is interesting for follow-up scans, because then we can reduce the total amount the patient will get to control for treatment effect, for therapy success, for example. And this enables us also to, for example, skip the administration of gadolinium maybe for follow-up scans when we just rely on the native images. And that's something we use for angiographies, for example, of the larger vessels, when we look for the cardiovascular system.
I can imagine that's very reassuring for patients to really know that they can have a less or even non-contrast, especially when they come back on a frequent basis.
And especially when they are younger, and maybe today they come for a cardiac indication, but we don't know what happens in the next years and decades.
Yeah. Thank you. I also want to touch a bit slightly onto the future, and also about increasing access to care. Professor Keller, could you share with us what would, in your view, be the biggest priority to increase access to cardiac MR?
I think one point is that people are knowing the advantages of cardiac MRI, what it can offer from patient side, but also from the referring physician side. The guidelines are recommending that, and access to this modality is something which is limited by limited resources. First of all, trained staff, and therefore AI algorithms, standardization, and automatic reporting and correction, for example, at the time of the acquisition of the data, when someone might not be so experienced that there is a software, for example, which helps that. Another thing is not to diagnose already diseased patients start pretty early, go for primary and secondary prevention, using a new approach in healthcare and going to the patient directly, even in rural areas, for example, using a mobile solution and combining this with a telemedical approach to guide, for example, these scans from a center, experience center, having some satellites outside in rural areas, and getting a strong connection. And this comes together with quantitative imaging. And something to do this is, for example, perform a cardiac MRI without contrast, with a short testing, to look for quantitative assessment of the heart function, like presented before, using a myocardial solution.
Yeah, so we also already showed the mobile that you currently have. And what also you say, it's really bringing all the elements that we already discussed today, bringing them together, access, quantification, to really bring that together. And maybe also, as a final question for you, Dr. Combs, what would be, in your view, the biggest priority in breast health to really improve the access?
Well, I guess maybe the scanning time. We are really working very hard to improve this, and we've done this actually with BlueSeal, because we have gone down from 40 to 20 minutes scan time, which is impressive, isn't it? But on the other hand, we need to standardize also. We need to standardize what we do in order to meet with the guidelines, and maybe also seamless integration of PACS and not only radiology information systems, but only hospital information systems, like the clinical information, and in real time maybe assess the risk of a patient, taking into account the integration of all that information, so that we can perhaps change the way we scan the patient in a more proactive way, I would say.
Yeah, very clear. I would like to thank you both for being here, to join us actually today at this launch event, but also really for sharing your inspirational insights, and also how BlueSeal really helped you in your day-to-day clinical practice. So thanks once more, and I would like to give them a big applause for joining us today.
Thank you.